All right, so we are live with Dr. Vinita Dubey. She is the Associate Medical Officer of Health for Toronto. Welcome to the live chat.
Well, thank you. Thanks for having me.
So you're going to be answering some questions today for us submitted by our followers, and we're very thankful for you taking the time. So let's get started right away. I don't want to waste any more time. The first question comes from Lori. Lori asks, could you please tell us the average length of time people with COVID-19 tend to have residual symptoms such as a cough or a fever?
So we know that by 14 days from when your symptoms start, most people have recovered their symptoms, but that lingering cough, that mild cough can actually last for weeks. We call it a post-viral cough, and it can actually be common after you've had many respiratory viral infections where you have irritation in the lungs, and that causes that dry and irritating cough that unfortunately can last for weeks.
Okay. Next question. We've received this question from a number of different people, so I've just put it together as one question. People who have sleep apnea, are they more susceptible to COVID-19? And if they use a CPAP machine for their sleep apnea, should they then separate themselves from a spouse or a partner and not sleep in the same room, because CPAP machines apparently give rise to aerosols?
Yeah, it's a really good question. I think what we know so far is that if you have a chronic medical condition, so heart disease, diabetes, sleep apnea would definitely be one of them. You are at higher risk if you get COVID to actually have a more serious illness. And so that's the first thing that we know for sure. Definitely with a CPAP machine, because there may be some, the way the machine works, if you are in self-isolation, if you've been exposed to someone who has COVID, or especially if you actually have COVID, absolutely, the recommendation would be that you sleep in a room on your own as much as possible to prevent spread to others.
Okay. And then this is a question from our City News reporter, Mark McAllister. He has a question regarding the Emergency Childcare Center at Jesse Ketchum. He's asking, how is it possible that a facility that was set up a month ago with all the necessary precautions in the midst of the pandemic can report positive cases of COVID-19? What went wrong, and is it that the children are passing it on from essential worker parents to other adults, or what is the causation there?
Yeah, so we actually know that we have community spread of this virus. And while we've reached our peak, we think, and the cases are going down, we still have a number of cases that are in the community. And so it's not uncommon in these what we call congregate settings. So settings where individuals spend a lot of close time together. It's not always possible to physically distance. So this could be, for example, in a long-term care home, in a shelter. But it can also apply to a daycare center where you can have, if there is someone who's infectious or contagious, they can actually spread the virus. And so we remember that we're learning more about this virus, and what we know is that you can actually be contagious before you even have symptoms. And so what I can say about this childcare center is that they've been following very rigorous procedures. There have been guidelines by the Ministry of Health that we've been following, and even going beyond that. So for example, every child that comes to the center has a screening tool done to make sure that they don't have symptoms, they have their temperature checked before they come in. And so it wasn't that someone was sick at the center and spread it, but you can be contagious before you have symptoms. And so I think that's what we're seeing in this center in particular. And once we identify cases, once we identify more than one case, we actually then use our other public health tools, which actually require that those individuals go in self-isolation to prevent any further spread.
Okay. We've got another question from Wayne. He's talking about reinfection. So once you've been tested for COVID-19 and you recover, can you get reinfected, or does it reactivate? A lot of people are talking about reactivation of the virus. Is that a thing? Does that happen, or do you just catch it all over again?
These are all really good questions, and they're actually questions that I want answers to as well. Because if you've had the infection and you've developed immunity, and that immunity will last, Well, that means then you're not likely to get reinfected again. It also means then when we think about a second wave of this virus coming, those individuals will be protected. But we're not clear that if you've been infected, that your immunity is actually going to last. We know with coronaviruses, like these are viruses that typically cause symptoms like a cold, and you tend not to develop lifelong immunity from these viruses, which is why we can get repeated colds even in 1 year. So we're not sure if you get the infection, whether you're actually going to be protected further on from another COVID infection. We're also not clear on whether you could get a reactivation of the virus as well. These are things that we're actively looking at and following the scientific literature on.
Okay, we have another question coming in right now. If someone thinks they had the COVID-19 virus in the beginning of, say, January, and they thought that it was just the flu, can they be tested today to see if it was COVID-19? Does the virus still, sort of stick around in your body enough to show up in a test?
So the test that we have right now in Ontario is called a PCR, or a molecular test that actually looks for the virus. The swab actually goes to the back of the throat, and what it's trying to do is to collect virus that's actually there. So if you've recently had the infection, you're symptomatic with the infection, maybe even you're a few days before you develop symptoms, then you're likely to be picked up with the test that we have. We know that there are a number of tests that are available worldwide that are what we call serology tests. These are tests that are classically tested from the blood, and they look for antibodies. And so they look to see whether you might have had the infection before. Right. We right now don't have a test like that we're using in Canada. We're waiting for Health Canada approval. And we have to be able to understand, first of all, does the test work? Will it accurately tell you that you had the infection? And then once you have that knowledge, what are we going to do with it? Does that mean then that you're protected and you could, for example, go into a long-term care home where there's an outbreak going and won't be infected again? These are the questions that we're going to need to look at as well.
Right. So speaking of that then, and antibodies, we have a related question from Paul Lau. He says recovered COVID-19 patients should have antibodies to resist second infection. However, there were reports in South Korea and China that there were multiple positive cases. So will we ever be immune to COVID-19? And can a recovered patient then still infect others?
So typically when you're recovered, part of the recovery process means that you're no longer infectious. And so what we use right now in Ontario is, for most people, we use a time-based system. So 14 days from when you had symptoms, if your symptoms have gotten better, if all you have is that lingering cough, then you're considered no longer infectious. And that's the case for most individuals. If you have a weakened immune system, you were hospitalized, you were very sick with this virus, you could actually still be contagious 14 days later. So sometimes in those situations, we might do a clearance test, for example, to determine if someone is still infectious, especially if they're still in hospital, to see if they need all of those precautions. So that's how we're trying to make sure that once you've had COVID, when are you going to be safe not to reinfect others and not to still be contagious?
And in terms of immunity, whether or not we're ever going to be immune, this is, as you mentioned earlier, something like the common cold, like you're never fully immune.
Well, we're not sure. We're not sure if it's going to be like the common cold where you're never fully immune, or you may actually get immunity for life. We're not sure. We've only had, 4 months or so with this virus. So we're trying to figure that out. The other hope for immunity, though, is that we'll get a vaccine. And if we have a vaccine that actually works, then it will be another good way for us to have, to boost our own immunity and to get herd immunity from a population level.
Absolutely. So I know that we've already addressed comorbidities and other pre-existing conditions, but this is something that constantly comes up with a lot of our followers regarding asthma and diabetes. Are these two populations particularly susceptible if you have asthma or diabetes?
We know that this virus attacks certain organs and certain parts of the body. So if you have any sort of lung condition, then you have to be clear that if you got this virus and it was an infection in your lungs, your lung condition, like asthma, like COPD, like emphysema, could definitely get much worse. But we also know that if you have other health conditions, like sometimes with diabetes, the diabetes impacts your kidneys, for example. And so because you have the diabetes and it may also make you more at risk if you have a COVID-19 infection to actually have more serious illness.
Right. This one is from Instagram. It's something that people have been asking for a while regarding a seasonal kind of disease. So will the summer season and the heat bring an end or a decline to COVID-19?
We certainly hope that it will, but it's not clear whether that's going to happen, because if you see right now, COVID-19 is in practically every country across the world, including some of the very warm climates.
Yes.
And so, Singapore had an outbreak right from the beginning, Taiwan, like those are warm places.
Yes.
And it's not that COVID didn't spread in those situations. So we can't just rely on the temperature or the change of season to be able to help us fight this virus.
Right. Okay. Another question that we've been seeing a lot from a number of different followers is about mental health and COVID-19 and the current conditions that we're all living through. A recent Angus Reid survey showed that 50% of Canadian respondents said that their mental health was affected because of COVID-19. So is the city concerned about that? And are there any resources, city-run resources for people in terms of mental health?
Mental health is definitely on our minds. The response to COVID-19, even if you're just staying at home, has impacted you, even if you never got the illness. If you got the illness, it's been really stressful and difficult from a mental health perspective. Or if you have a family member, or if you work, in one of those professions that are dealing with these patients, it's a really difficult on individuals' mental health. And so it's definitely a priority for us, actually, at all levels of government. And the Ministry of Health has announced funding for it. From Toronto Public Health, we're supporting resources. So there are a number of resources available for mental health. On our website, toronto.ca/COVID, there's actually a section on mental health with a list of a lot of really good resources. And if someone's ever not sure what to do, they're not sick enough that they need to call 911, they can actually call 211, and 211 will link them to community agencies that could help them.
Okay, that's good to know, 211. Okay, not 911, 211.
That's right.
Important to stress, yes. Okay, so we have, let's move on to the next question. Do you think non-medical masks will be required going forward, even as we reopen the city?
It's actually a question that we're looking at. We're actively looking at this question. The Public Health Agency of Canada has said, and we've also reiterated that message, that you can wear a non-medical mask, we call them cloth masks, or a facial covering, something like a scarf. The idea is to cover your nose and your mouth. And the idea there is that your germs stay within the mask, and it actually works to prevent your germs from getting to others. And so we've already said that, if you're in a place where it's difficult to maintain physical distancing, for example, you're doing going grocery shopping, it's an essential service that you need to do, but you can't maintain that physical distance, wearing a mask could be helpful in that situation. So we already have that advice already out there. We have seen in other jurisdictions that they have required or suggested that everyone leaving the house needs to have a mask. And that's certainly something that we in Toronto are going to be looking at to see if that might be a recommendation to help us prevent the spread once we start opening things up a bit more.
Right. So a related question to that, Josh is asking, when it comes, so you've said that, masks protect the spread to others, but we've also seen that people are using filters in masks. Do filters, first of all, protect you? And secondly, what kind of filters would you suggest using in a mask? Like, there are numbered filters. Some people are saying use coffee filters. What would you suggest?
There's some really helpful information on the Public Health Agency of Canada's website on masks. It actually even goes through how you can make a mask. It talks about filters as well. I think the important message here, though, is that we need to keep the medical masks for healthcare settings, like long-term care settings or in hospitals. And that if we want to, for example, add a filter to our mask, that it needs to be aside from using a medical mask. But there is definitely, because there's some of those nuances that are available. I would, even if you go to our Toronto Public Health website, we have a link to other information to get some more information on masks. But essentially, it's the 2-ply cloth of the mask that's helpful. There haven't been studies particularly that have looked at a cloth mask with a filter and without a filter per se.
Right. Okay. Okay, that's good to know as well. And then this next question, we've got, I think people are finding it difficult to really define asymptomatic. How long can someone be asymptomatic, and do they recover in the normal course of time if they are asymptomatic? Because it's thought that, people who are not showing symptoms are still spreading it. So if I'm asymptomatic, how long do I still have the virus? How do I know if I'm spreading it?
Yeah, so we actually have 2 categorizations for individuals. One is asymptomatic, they truly have no symptoms, and one is pre-symptomatic. The symptoms are so mild that they haven't actually recognized it, and they may actually just have those very, very subtle symptoms for the rest of their infection, or may go on to develop additional symptoms. We find that when we, for example, look in a long-term care home of individuals who have been tested, because now we're testing more in long-term care homes, individuals who did not have symptoms and they come back positive. When you go back, you can actually find that actually there were some subtle symptoms beforehand. And so I think part of it is recognizing, could there have been a subtle symptom that we've missed? So actually that you were asymptomatic. That being said, we do know that there are some individuals that have no symptoms. And so what we use in public health is we say, the day that you got your test done, we will consider you contagious for 14 days thereafter, just to be able to mark out how long you would consider to be contagious. And in the meanwhile, we'll keep looking at the science and the evidence to see if we can get a better sense on this.
Okay, here's another question that just came in live from Mary. Is it possible to get sick if you use an elevator after somebody who was infected was in it? And if yes, what is the time limit for this to happen?
It's a good question. So we don't say that COVID-19 is spread through the air. And so generally the droplets tend to be big enough. And so if you cough and it's suspended in the air, it's heavy enough that it's going to fall to the ground. Okay. Unlike something like a virus like measles, where if you cough in the air, the particles are so small that they actually can stay in the air for 2 hours after someone has left. For COVID-19, we don't believe that that's the case. We certainly haven't seen that. If it was spread through the air, that if you walked into an air where someone who had COVID was, then we might expect to see a lot more cases that were related to that. Right now, we're pretty much seeing it's mostly spread through that close face-to-face prolonged contact. So what I would say is, probably the bigger risk in an elevator is not being able to physically distance. Being in an elevator might be a good example where you might wear a mask to prevent some of that spread as well, to keep, again, some of those germs out of the elevator. The other thing I would say about the elevator is it's, touching buttons, those are common surfaces. And so keeping those cleaned regularly and making sure you wash your hands after you leave an elevator is probably really important as well.
Okay, so sorry, you mentioned masks again, and we have so many questions about masks. There's another one from Debbie, and she asks again, you might have covered this already, but going grocery shopping or anywhere in public, should you wear a mask? And then should the employees be wearing masks as well? And why hasn't this been mandated instead of just suggested?
So as I said, this is something that we're looking at, especially as we go into our recovery and rebuild phase. We've seen this in other places where as they let more and more people out into public, the use of masks or the recommendations for masks has changed. So this is definitely something that we're actively looking at. More to come on this.
Okay, this is an interesting one. Megan is asking, is there any evidence that after people recover from COVID-19, there could be long-term organ damage?
So this is a question more for our clinical colleagues, especially our ICU colleagues. I think the way to think about COVID-19 is that it's an infection. It's a viral infection. And I know from working in an emergency department, when you have someone who's really sick with a viral or a bacterial infection, when they come in and their organs are infected by the virus, we call that sepsis. It's a full body response to the infection. And sometimes you can certainly have damage to your organs, or it can be difficult for your body to respond or to recover from illnesses like that. And so it would depend on the type of infection that you had, how serious it was, in terms of how long you might have lingering consequences, or maybe even permanent consequences. I think, again, as we're trying to find out more about this virus, we'll be able to answer some of these questions.
Right. Everything is still very sort of up in the air. I think as we're, like you said, as we're studying this virus, we're learning more and more about it. So the long-term consequences are probably not available right now in terms of any sort of control group or anything that you've been able to monitor, correct?
That's right. And I think it's really important that we keep track of long-term consequences. We know, for example, viruses like West Nile virus that comes in the summer that spread through mosquito bites. Some individuals might have mild symptoms, even Lyme diseases like that, but they can actually go on to have more chronic symptoms that can last for a while. And so I think we need to definitely keep a close eye on this as a scientific community.
Right. And speaking of, future testing, are there any further developments on antibody testing in, Canada or Ontario?
So we're waiting for Health Canada approval for some of these tests before they can be used.
Mm-hmm.
And then once we have tests available, we'll have to understand who is best to get the tests, where can you get the tests, and how do you interpret the results. But right now we've had no approvals from Health Canada on using these antibody or serology tests.
Okay. Another question we've been getting a lot is, of course, asking about vaccines, and we all know that it takes time. But do you have a timeline? Are we any closer? I know that around the world people are doing a lot of. There's various different countries that are doing testing. In terms of Canada being close to a vaccine, do we have a timeline?
In general, what we're saying in the science community is about 18 months is what it takes to kind of develop a vaccine. We have to make sure when we have a vaccine that, first of all, it's safe to use, and second of all, that it's going to be effective, that it's actually going to work. So on the one hand, there's the laboratory studies to actually develop a vaccine. And then but then you also have to be able to do some tests to make sure that it's something that if you could ask everyone to get a vaccine to protect themselves, that it's going to be safe to use and that it's going to work. So 18 months is about the time frame we're talking about. It may be longer, it may be shorter.
Right. And maybe this is a catch-22 question, but in terms of Toronto and maybe even Canada, is there any chance that would be mandatory to get vaccinated? Because I know that there's a lot of controversy about vaccinations and a lot of people have their own opinions about it.
We don't have any vaccines in Canada that are mandatory, actually. You always have a choice. And so even if you have a child who attends school in Ontario, it's not mandatory that every child be vaccinated. They either get vaccinated or they get an exemption to be able to attend school. And so So you can imagine that if a vaccine were to come out, it would not be mandatory per se. Yeah.
Okay. And then this is a slightly on the flip side of vaccines and things like that. This is a question that we get repeatedly across the board about groceries and bringing them home and disinfecting them. What do you need to disinfect? Do you need to disinfect all the plastic packaging? And because fruits and vegetables, we always wash, right? We always make sure that those are safe. But plastic packaging, anything that has a covering, do I need to disinfect it when I bring it home?
So what we know right now is there's no evidence that COVID-19 is spread through food or food products. Okay. So I think it's important to kind of go back to the basics to say, well, how can you catch this virus? And the way you commonly catch it is from that close contact with an individual. You can, from a contaminated surface, have it on your hands, and then you can infect yourself by rubbing your eyes or your nose. Those are the commonest ways that it's spread. There's no evidence that if you eat, say, a food that might have COVID on it, that when it goes into your gut or your stomach, that's going to cause an infection. Right now, we don't have any evidence for that. Okay. So because of that, what we say is that you should follow your routine food handling practices. So
Mhm.
make sure that you're heating your foods up properly. In terms of the packaging, there's no need to sanitize or disinfect the packages. In fact, you want to make sure that the food that you're eating, that you're not putting chemicals like disinfectants, which can actually be poisonous on them. I think the more important thing is when you're handling your groceries, that you make sure that if you're using reusable bags, that you wash them. If you put them on a surface, that you make sure that you clean that surface afterwards, and that you make sure that that you follow the basic food safety guidelines to make sure that you don't spread it in other ways.
So just an addendum to that, and this is something that we covered last week as well, but I think people are still very worried about it. We're hearing about, support your local restaurants, take out food, pick up delivery, all of that kind of stuff. But people are also worried about, like you said, handling food safely. And so what are the what is the possibility of getting COVID-19 from say if somebody who was infected prepared that food?
So we do right now have pretty rigorous food safety guidelines, measures that are required, that restaurants are required to follow. So it includes things, for example, that an employee should not work when they're sick, that they should make sure that they're washing their hands, that they shouldn't be sharing their germs when they're preparing food. And so following those basic food handling guidelines will pretty well cover you from assuming that your food might be contaminated with COVID-19. I think in terms of getting that takeout food, again, it's making sure that you don't make contact. Try and keep your 6 feet distance when you're dealing with at the restaurant or the delivery person, and then making sure, with the packaging, that you're washing your hands, that you're cleaning the surfaces afterwards as well, and that you keep the cold foods cold and the hot foods hot. And so heating your foods up, again, is usually another really good way to be able to ensure that if there are viruses or bacteria in there, that they've been killed.
Okay, I think we have time for maybe just one last question with you, doctor, because I know you have to wrap up at 1 o'clock. So we've been seeing that people are still allowed to go outside, take a walk, get some fresh air, maybe not every day, maybe once in a while, as well as go out for essentials. People have been asking a lot about riding bicycles and running and jogging and that kind of thing. Is that still safe? Do you still need to maintain the 6 feet distance? And what are the chances in terms of, because when you're jogging, you're breathing heavy. When you're cycling, you're breathing heavy. What are the chances of somebody catching that when they're passing you on the sidewalk?
Yeah, so I think, it's hard to be able to quantify every individual risk. If someone is actually sick with COVID, they should not be out exercising at all. They should be in self-isolation. And again, passing someone is probably a lower risk, but again, you can't say that there's no risk. And so I think that's why keeping that 6 feet distance is important. Sidestepping people, trying to make room for others as they're doing their various forms of exercise, I think is what we all need to do, because the risk, I can't tell you that the risk is zero. It's probably low, but I can't say that it's zero. And so, but what I do know is that the virus tends not to spread past 6 feet, because it's spread through those droplets. And so if we can keep that distance, that's going to be the safest.
And so just to reconfirm then, you have said that currently it's not airborne. You don't believe it to be airborne. It is droplets, and those droplets fall to the ground. That's
right. And another way to think about airborne spread, I mean, we're still learning more about it, but you might expect that if you had an individual who was sick on a plane, that then more people on the plane might have got it. Or if you had someone passing through an airport, more people that way might have got it. Places where they weren't able to connect, where they got it. And we know that early on in the outbreak, when we identified our cases, when we didn't have community spread, we had very close ties for how individuals were getting infected. Again, that's what we know right now. And I do want to qualify that, because as we learn more, we'll be able to share more as well.
Okay, well, thank you so much for joining us today, Dr. Vinita Dubey. This was very, very educational. Thank you for answering all the questions that we got from our followers. We will be in touch, and we'll continue to follow your lead and Dr. De Villa's lead from Public Health. Thank you so much.
Thank you. It's my pleasure. And, I just encourage everyone, thank you for staying home. Thank you for practicing physical distancing, and thank you for staying safe. So thanks very much. Bye-bye.
All righty. Bye-bye.